Thank you. I'm here to talk about the continual need for improving and technological innovation regarding infection control. And really that's a supplement to things that are going on already in the healthcare. So it's there to supplement good clinical practice. It's there to supplement good aseptic technique and prudent use of antibiotic prescribing. It's not there to replace any of that. It's there to support the workers. So I just want to really outline where this problem first began and you know, how far have we come. So I just want to talk about a young ambitious doctor who was doing some research into high levels of maternal and neonatal mortality. Thought, yeah, I've got a cause here. I think it could be the reason, and kind of talked about it. And congratulations, they were demoted. They then went about and had a look and found a new technology, put that technology into use and reduced the mortality within a month by quite a significant amount. Published it, but again, didn't get much support. So continued on with this technology and reduced mortality to about 0. Said to everybody, look how brilliant, look what this has done. Should we really go ahead and try and make this widespread throughout the service? And that was rejected. And ultimately, they were fired, rejected from other jobs, published it, didn't do very well with the reviews, committed to asylum and died within a fortnight. So who wants to take on technology? Who wants to help me take this forward? Does anyone know who this is? Exactly. So it's not a new problem, it's a very old problem. And even when you've got quite a significant amount of evidence to support what you've got, sometimes it's the adoption of that and it's putting into practice that can be the problem. There's a graph that tries to explain this and tries to explain adopters of technology and how this is brought along. It's the technology adoption life cycle. And really, what you've got is you've got a group of people that like evolutionary change. They're quite pragmatic about things, process orientated, a bit risk averse, and really want to see all the evidence straight away. Now, that probably sounds quite familiar to people who work in the NHS. It's really, I need to see the evidence before I can move, and that's a very sensible approach. But what that happens is that you get a chasm of people that like revolutionary change, visionary kind of project orientated and risk takers. They'll adopt technology fairly quickly, but there is a risk there. So you need to find a balance. So there's the challenge. Traditionally, adopting technology in the NHS is expensive, it's time consuming, both for industry and the NHS. And there's little opportunity for people who are using technology to actually input and say, we don't need it like that. I don't mind if it's green or blue. What I need is it to look like this and it needs to work in this fashion, this quickly. And really that kind of interaction hasn't been there. And there's few opportunities for patients to kind of give their input into, well, how was that for you and what impact did that have on your journey, so to speak. So the solution from the department has been to set up a technology innovation program. So that's looking at technology that the NHS is actually after, products that add clinical value at the front line, looking at the economic value, swifter development, and trying to give a broader understanding of NHS requirements to industry. This is done through a number of hospitals that formed a research network with the department. There is 9 showcase hospitals spread throughout the country, and each one has a project lead that's in post to help with the evaluation, both adoption of the technology and also some clinical evaluations of new technologies. The idea is to speed up the innovation and adoption of new technologies have the evidence. So it's split into several areas. First is to encourage new ideas, and that was through 2 programs. One, Design Bugs Out, which some of you might have seen, and there's a Smart Ideas program which had NHS workshops asking, what are your real barriers? What are your issues at the front line? We're not interested in what you think the solution is. What's the issue? We'll take that away and try and work with industry to come up with that solution. Support for innovators. So this is support for both people within the NHS who have an idea and also industry that have an idea and said, right, I can't get into the NHS, nobody's listening to me, where can I go? So Smart Solutions is for the NHS, and product surgeries, there's a system within the department that if you're an innovator, you can come in and talk to somebody, and they'll talk through, have we seen it before? Is it a good idea? If it is, maybe we can do something with you. If not, maybe we can point you in the direction of somewhere else. Once we have the products, showcase hospitals, events and exhibitions such as these to allow everyone to see what's been looked at. And the products need assessment. So there's a rapid review panel, which forms almost a gatekeeper to a lot of this, that reviews the evidence supplied by NHS and industry around the product, the efficacy of it. If you get a good recommendation from the rapid review panel, then we can take you into the showcase hospitals. We also support the hospitals in their local research and development, which is the local technology reviews, and then have a lot of independent assessments of products such as microfiber, some of the sporicidal disinfectants, things like that we've been looking at. So how do we know that a product works? And currently, some people might feel like this, you know, I've seen it, but just tell me if it works. I don't know. So we're trying to put a framework around that to allow people to have a bit more of an understanding, a bit more of a direction. And the Rapid Review Panel was formed to do that. It was formed in 2003 by the Chief Medical Officer, and it met first in 2004. Its remit is to give a quick evaluation of the evidence supplied with a product to say whether it merits further investigation. You can get a recommendation which is, yes, this is brilliant, the NHS should be made available, not the NHS should buy it, it should be made available for the NHS to look at and to purchase, ranging down to it's nothing to do really with infection control. The panels looked at a number of products, and the disappointing thing here is that only 11 out of 311 got a recommendation 1. So the evidence that is needed for adoption is quite high, but the evidence that's been supplied by industry is not, it doesn't match that kind of standard. And I think that there could be a lot done with speaking to industry and speaking to NHS and trying to get a match of what's required and how we can kind of bring these two together to focus R&D and industry's money and the NHS a bit better. What is quite encouraging are these two. A recommendation 2 says a further in-use evaluation is required. So, okay, it works in the lab, but let's see really what happens in a practical environment and whether it actually makes a difference. And this recommendation 3, which is, it's a good idea, go back to the lab and have a bit more work and come back and we'll have another look. So there is potential, there's potential. Unfortunately, recommendation 5 is there's just not enough information supplied to make a recommendation at all. And that's a huge number of products. And really that just emphasises some of the misunderstanding that was spoken about earlier about people not really getting a grip with what their product is and supplying the required information. We also need to know, right, does it work? Rapid Review Panel says that. But how much does it work? And what is the overall value to the NHS? You can have something brilliant, but if it sits on the shelf and nobody uses it, there's really no point in the product. So what barriers can we take away and how can we remove those to improve adoption? Showcase Hospitals have looked at the Rapid Review Panel 1 recommended products, and I'll just go through them. The silver alloy coated hydrogel catheter. This was reviewed right at the beginning, and I know there's further evaluations underway over the efficacy of this product, but initially it was thought it was a very good concept. ATP testing, there's 2 products that fall into that category, and it's looking at, let's improve the cleanliness. How can you actually, instead of saying that looks dirty to me, how can you have a measure of the cleanliness of the ward, and then how can you actually target against that? Hydrogen peroxide vapor systems, some ChloraPrep, which is pre-insertion skin dressing. That falls in line with some of the EPIC guidance. That was given a recommendation 1. There are 2 fecal management systems, Convatec and Zassi. Integusil, which is it's a sealant for prior incision for surgery. It almost laminates the skin instead of trying to kill the bacteria, which we've heard is reasonably difficult. This is looking at, let's stick it to the skin and stop it sloughing into the open wound.